Well, I call the expert. Yes, Dr. Connie Case-Boat Carver is with us, Wellness by Design. Dr. Connie, how are you?
I'm doing great.
You got a big multi-syllabic word we're talking about, regenerative.
Yes, regenerative medicine.
Yes, and to break it down even smaller, chronic pain. And
Yes.
you have kind of a reason why chronic pain is so important to you and why you want to help fix people with chronic pain.
So briefly, my mother suffered with rheumatoid arthritis the last 35 years of her life. And she was miserable. And she didn't get to be the kind of grandma to my children that she would have been had she not been in chronic pain. So as you know, chronic pain is defined as anything more than 3 months. It turns out that 20% of Americans, which is 50 million people, have chronic pain, so it's a big issue. Sometimes surgery can alleviate it and fix the problem. Sometimes medications are helpful, but not always.
But you can get addicted to painkillers.
Exactly. So medicine's always,
like.
yes, within 2 weeks you can get addicted. So people are searching for perhaps another approach, another something else they can do, and that's one thing we specialize in. So we have, as you mentioned, that big word, we have an umbrella of regenerative therapies, which includes ozone. People think of ozone as an environmental contaminant,
Right.
but ozone has been used medicinally for over 100 years.
Really?
So when done correctly, it's safe and very effective. So we can inject ozone into joints. We can also inject stem cells, which we've talked about this before, stem cells being derived from perinatal products. So healthy baby born to a healthy mom, harvested, tested, incubated, made sure that everything's safe. So either one of those is considered a regenerative therapy. So I think there's a picture coming up of me injecting a knee.
Of a knee, okay.
Yes. So it's a really quick, kind of simple procedure. Most people say on a scale of 1 to 10, the pain is only a 1.
Really?
No, it's really not. It
Well,
doesn't really
all
hurt.
she had to do was roll her pants up too. It's not
That's
like
right.
it's
That's
not
right.
even like a big thing. Yeah.
No. And I have a model here. This is, of course, a knee joint.
Right.
And so I just have the patient bend their knee at a right angle.
Yeah.
And it's pretty easy for me to slip a little needle in here. And we just fill up the joint space, first of all, with some numbing medicine.
Yeah.
And then we follow it with either ozone gas, or sometimes we'll combine ozone with stem cells.
Right.
And the same thing with the hip. And I brought these two because these are the two most commonly replaced joints.
Yeah.
And of course, you have to walk on your hips and your knees, so there can be a lot of pain.
Yeah.
So with the hip, we have a person lying down, and I just put the needle right in, and we just put the gas, the ozone gas, and/or the stem cells in this general area.
So the ozone is a gas. I thought it must be a liquid.
No.
But it is an actual
it's a gas. In fact, when people get their knees injected in particular, they say it's like having Alka-Seltzer in their knees.
Really?
It actually bubbles after
Plop,
we
plop,
do the
fizz,
procedure.
fizz.
Yeah, it does. So we move the knee back and forth, and you can hear it just bubbling. Now the gas will absorb fairly quickly,
Through the
but the
bloodstream.
regenerative properties of the ozone will keep working for days after the injection. So we can often get people with ozone out of pain within, I mean, basically they walk out of the office out of pain.
Well, now, Ann is the lady to answer some questions if you make a call.
Yes, if people are interested in more, they could just book an appointment with me. That's one way. They could also see Ann first. Her appointments are free, just so that she can give them an overview of what to expect and what we have and the pricing on the different options.
Sure.
So either way.
Well, I've been bad, and I have a confession to make. I did something that you say you try to steer people away from, cortisone.
Oh my. Yes, so cortisone is one of those Faustian bargains with the devil.
Yeah.
You can get some short-term relief.
Yes.
Yeah.
Which sometimes that's really important.
Right, like if something's been hurting for 3 months,
Yes.
then
You
it's
can
gone
get some
like that.
short-term
Yeah.
relief, but the studies show that it actually decreases your own ability to produce stem cells. So it actually slows your own ability
Bad
to...
girl.
Because I thought that was
Bad girl.
steroids. If you did steroids, that did it. I mean,
Well, that is a
it's
steroid.
Cortisone is a steroid.
Yes. And it's not that steroids are never appropriate. It's
Right.
just that you need to be careful and not overuse it.
Right.
Even other doctors don't repeat steroid injections more often than every maybe 2 or 3 months because
Right,
they
right.
know that it can inhibit the natural healing ability of that joint.
See, guys, this is why you got to go talk to her, okay? These are mistakes we've made,
Doc,
you don't have to make again.
Tell us exactly where you are on Pleasantburg.
Yes, 850 South Pleasantburg, a block from Cleveland Street, which is where that brightly colored bowling alley. They
Bowling
get free
lanes.
advertisement
I
from me
know,
all the
all the
time. I
time.
tell them
Send
about
them
the
a
bowling
bill.
alley.
I'll send them a
They
bill.
should
I know,
hook you up
right?
with your own lane. Just get that. You go
So-
bowl. Thank you, Dr. Connie, from
Thank
Wellness
you.
by Design.